Josephine Wamboi Gitahi. This is my 17th year living with diabetes. I was diagnosed with diabetes in 2005. I was referred to Kenyatta National Hospital, where I was started with insulin medication, which is the only diabetic medication for type 1 insulin. Management of diabetes and other NCD, it's very expensive. It entails a lot of investment, personal investment from you and also from your caregivers. So for me, it hasn't been easy. The main challenge I had as a young person with a rare disease, diabetes, was discrimination and stigmatization. I really faced a lot of stigmatization, and I can't blame the people who discriminated me simply because they were not aware of the diseases or the condition. Being diabetic or experiencing any other NCD is not a smooth sailing. We really faced a lot of challenges. But then we need backup, people who will support us morally, financially, or even any other way they can support us. And the main people I'm going to call on action are the government and policies makers. One, we need more resources for protection and control of the NCDs, because I believe prevention is better than cure. So we need to control them, simply because most of these NCDs, they are the main reason where we have a lot of disability and death rate. We really need our society to have more productive people. The other one is accessible and affordable medication for NCDs and technology. We believe here we are begging our government to reduce the prices of our strips, but in other developed countries they are talking about CGMs. We also want our government to make us reach that capacity where we also are going to afford CGMs and insulin pumps. Then I also believe that we need to be engaged. Meaningful involvement of persons living with NCDs in main decisions making that concern us. And the last one, I also believe that we need affordable and comprehensive NHIF cover.
Naitwa Ana Mutunga. Nashukuru Mungu sababu amenisaidia. Sababu nilikuja nikapatwa na shida na sikujua ni nini. Nilipoendelea na kutibiwa, kuangaliliwa, nikakutana niko na kansa. Imebaki kitu kidogo ikuwe stage 4. Kwa hivyo nashukuru Department ya Health sababu nilipoenda walinisaidia sana. Na kabla sijalemewa ndio wakasema nitafanyiwa operation. Na nikafanyiwa operation, wakanisaidia, nikatolewa ovaries hiyo zote mahali zilikuwa zimeshika. Na sasa nimekaa miaka mingi na sina shida yoyote. Kwa hivyo nashukuru. Na wale wanapatwa na shida, mkiambiwa endeni mkaangaliliwa hospitali, msikatae. Watoto wakajua, lakini walikuwa wananiambia wataendelea na kuniombea, watanipeleka hospitali sababu hapo ndio naweza pata msaada. Hawakunichukia, hapana, ni kuniombea na bwanangu kunipeleka huko hospitali pamoja na watoto. Na mtu akiambiwa kuna kansa, unakuwa frightened, unaogopa, unaona kama utaenda kukufa. Hata mimi nilikuwa naogopa, naona ni kama nitaenda sasa kufa. Lakini encouragement, watoto walikuwa wananitia encouragement, hata bwanangu. Ningeuliza ikiwa ni serikali kuu kama inaweza chukua hiyo kama mzigo, na sababu hiyo shida ni kwa kila mtu. Mkubwa, mdogo, shida ya mwili, magonjwa inatokea. Kama kwa njia moja ama nyingine inaweza kuingilia na kusaidia, ndio iweze kusaidia mtu aweze kupona. Sababu ni vizuri tukiwa tunaonana na watu wanakaa kwa maisha marefu. sababu kuna magonjwa mengine inakuja haraka haraka na bila pesa mtu anakufa. Inaweza kuwa mtu anakufa siku ambayo Mungu hajampangia, lakini kama serikali ikija kujulishwa kuna mtu amelemewa na hii na hakuna pesa, kuuliza kwa heshima, iwe wakiambiwa huyo mtu inachukua kama huyo mtu patient inamsaidia kwa kumlipia ama atibiwe.
Nyambega, a 13-year-old stroke victim, or we normally call it survivor. Stroke is a condition that comes as a result of blood stopping in some part of the body. So stroke can be described as an accident of the brain. I got this thing, this accident, as I've said, in the year 2010 in my rural village called Manga. It was very difficult for me to know myself. I didn't even know. The last thing I saw I have just fallen down and unable to wake up again. I was unable to tell exactly what was actually wrong, as I have said, simply because I lost all my thinking capacity. On reaching the QC level 5 in the evening, the doctors had gone, and nobody did anything to me until the following day. So, if by average, if you can count, these are like almost 3 days now. And now, they decided to take me to Nairobi. As you can see, this is now like almost 8th day. I was still feeling a lot of pain. Then I could not even wake up. Then after deciding now to take me to Nairobi, almost, as they told me, almost now 10th day. This is now where I got some, they reached in the evening, I got some help. As you can see, I am going around like this simply because of facilities, lack of facilities, and lack of doctors. So, if all these things were available, I could have been saved in Kisii.
I was diagnosed with breast cancer in the year 2020. I first went for the surgery. That is what the doctor advised me, because it was urgently needed for me to undergo the surgery. Then after surgery, I started my chemotherapy, which I went for 8 sessions for the chemotherapy. After that, I went for the radiotherapy for 15 sessions of the radiotherapy. I'm still under medication. I'm undergoing hormonal therapy. That is, they are accepting to balance my hormones. With accepting that I had cancer, it was really difficult for me because in my mind I had the knowledge that once you diagnosed with cancer, that is the end of you. So in the first place, I thought that was the end of me and that was the end of my life. But after guidance and counseling, I had to accept myself. I had to move on with life, undergo the treatment. And now the other side of my friends, my family, it was really hard to handle my friends, my family to handle me having that, they have a family member having cancer. It was very hard for them to accept. But with the time they had to accept, but it reached a point that it was all in vain. Because there was the part of rejection. It reached a point that they didn't believe that I was going to be healed. I was going to be out of this treatment for cancer. I was going to be a normal person. So they still had the knowledge of cancer is a death sentence. Even up to now, I don't think whether they still believe that cancer is curable. Now, to my understanding, when I was diagnosed with cancer, I never knew that having one breast, you can still be a mother. So the doctors said that I can still have children, as many children as I want. I can breastfeed with one breast. And then there is nanny. Unaweza pea mtoto nani? Unamboost because haezi shiba with one breast. So I can still be a mother just with one breast. When I started my medication, first I went for nilienda kwanza kupimwa. Na hizo vipimo, they costed more than 50,000. Kupimwa peke yake. Before I could start the surgery, the chemo part of it. NHIF ilipii kila kitu yote kwa hospitali. So that is why I'm calling out for the national government, county governments. They should try to allocate a good funds for such diseases, because it really drains the patients.
I'm from the Young and Sweet podcast group, and with you here, we are in the Westland facility, that is Westland Health Facility. It's based in Westlands. I've been diabetic for the past 10 years now, since 2014. I was diagnosed with diabetes type 1 when I was in Form 2, that is high school, in 2014. I will say, okay, I didn't know anything about diabetes before I was diagnosed, so it came as a shock to me and to my family. One of the challenges that I faced is transitioning from a completely healthy person to now a diabetic lifestyle. Everything changed. I would say the most challenging bit about being diabetic is having to deal with hypoglycemia, that is low blood sugars, and being able to manage my condition and avoiding hyperglycemia, that is high blood sugars. Another thing that I would say it came as a challenge, and it's still a challenge, is access to diabetes supplies. That is insulin, strips, glucometer, medical, and everything that's medically that are type 1 diabetic. So my call to action to the government will be, first I'll pose it as a question. So why cover for a person living with diabetes only for dialysis and with insurance cover, and not cover for the patient to get his or her medical supply? So my appeal to the government is to try to minimize or to cut down the prices of medical supplies of any type 1 diabetic patient, and also to include all the tests and everything that involves a type 1 diabetic person in management of his condition, to cover for NHIF to cover them. For example, for the tests that we do annually or monthly or quarterly, or the medicine that we need, that is insulin in the strips.
Naitwa Josephine Jerry Kioko kutoka Itandi Village, Kilala, Makueni County. Mimi ni mgonjwa wa asthma na nimekuwa na huo ugonjwa kwa miaka zaidi ya 20 years. nimekuwa mwathiriwa na imenipa challenge. Since 2006 nilikuwa nimetembea sana mahospitali, Nairobi, kwingi sana. Lakini baada ya kutumia pesa mingi nilirudi Makueni Hospital. Ndo nilipatikana ni asthma. Sikuwa najua nimegojeka nini. Nikapimwa nikapatikana niko nayo. Na ile challenge niko nayo, unaenda hospitali, unaandikiwa madawa. Madawa ni pesa, chakula ndo hiyo, uko na watoto wako shule. Imekuwa ngumu sana. Kitambo nilikuwa natumia NHIF. Kumbuka NHIF kitambo ilikuwa ni 150 per month. Ilikuwa at least. Sasa wakati ilikuwa ni 500. Sasa ikanishinda kwa sababu nimesema niko na watoto wako shule. Nimesema chakula ni pesa. Hii ugonjwa imeniadhiri sana, siwezi fanya kazi kwa ngumu. Hapo zamani wakati nilikuwa nikiwaelezea ama wakiniona niko mgonjwa, wengine walikuwa wanaona ni laana, wengine walikuwa wanaona huu ugonjwa uponi ni wa ukoo. Lakini kuna CRFs, community health volunteers sasa ambao walianza kuwatembelea na kuwahimiza na kuwaambia kuhusu hii ugonjwa ya asthma. Sasa walianza kuitikia, na pia katika hiyo CRFs kuenda na kuwahimiza, kuliibuka wengine walikuwa wako na shida ya asthma. Na sasa kwa sababu asthma ni kama allergy, walianza kuitikia na kuichukulia tu ni ugonjwa. Mimi kama mgonjwa wa asthma, kuna kitu nataka kuomba serikali. Kama vile haya magonjwa na COMMUNICABLE diseases, kama kuna vile wanaweza wakatusaidia, kwa sababu ni magonjwa yanakuanga na pesa mingi. Na ukiangalia familia kama vile ufanyi kazi, inakuwa ni ngumu sana. Kwa hiyo naomba serikali ituangalie vizuri, kwa sababu kama ni kufanya kazi, huwezi fanya kazi, kwa sababu itakuwa ni unanunua dawa kila siku for more than 8 years.
Mimi naitwa Jacinta Kamili. Mimi nakaa Kilala, kazi yangu ni kutibu watu na ninaishi Kilala town. Sasa mimi enye ninatibu hapa Kilala, kama ninakuja hapa nitibu watu wenye wanakuja hapa, mwenye ninatoa kwa ugonjwa ni kama mtu ako na majini, mtu ako na bingo, mtu kama anakuwa na ugonjwa ingine kama iko ndani. Lakini ile ingine kama sukari, ukimwi, kama TB hivi, sasa hiyo siwezi tibu. Hiyo nachukua huyo mtu na nampeleka huko hospitali. Hii nimepewa risiti kutoka wote. Na hii risiti napewa ni Mulatia. Na kuna madaktari wengine wako huko wote. Na hiyo ndio napea mtu, nakuja hapa, nakuja naangalia hivi na nakuandikia. Nikikuandikia hiyo risiti na kutuma, unaenda huko wote, unaenda unaangaliliwa mambo yako. Hiyo ndio na kuandikia hiyo risiti. Sasa kusema kwangu ni kusema kama hiyo ugonjwa ya sukari, ugonjwa ya TB, ugonjwa ya ukimwi, kansa, hiyo maugonjwa ni mingi sana. Na watu wakikuja kwangu naona hiyo ugonjwa inakuwa mingi. Kwa sababu wakikuja hapa ninawatuma hospitali na wengine nikikaakaa wanakuja tena. Sasa ndio nasema kama ni watu wanaenda huko hospitali, nasema serikali kama inaweza ikuwa inaleta madawa kwa haraka, kwa sababu watu wanakufa haraka kwa hiyo magonjwa. Walete dawa ndio hao watu wakuwe kama wanatibiwa haraka kwa sababu wanakufa.
I'm Catherine Karekezi, Executive Director of the Non-Communicable Diseases Alliance of Kenya, which is commonly known as NCDs. Non-communicable diseases are conditions that cannot be transmitted from one person to the other And these include conditions like diabetes, heart diseases, cancer, sickle cell disease, chronic respiratory conditions, and even mental health conditions. So one of the key things that we are focusing on is ensuring that persons living with NCDs are meaningfully involved in all areas of the NCD response. We thought that NCDs, non-communicable diseases, were mainly affecting individuals in the developed world, but this is actually not the case. It is now known that the burden of NCDs is actually much higher in the low and middle income countries. At the moment, NCDs account for at least 50% of all hospital admissions, up to 55% of hospital deaths, and about 39% of the total deaths in Kenya. Persons living with NCDs do face multiple challenges, not just in terms of access to treatment and care, and loss of employment, and stigmatization, and so on. But I believe that with universal health coverage that the government is currently rolling out, NCDs, we as NCD Alliance of Kenya are advocating for packages for non-communicable diseases, meaning that if you're living with diabetes, if you're living with high blood pressure, you have a heart condition, that your treatment and care, at least essential treatment and care, will be covered under the UHC, that NHIF will come up with comprehensive packages for treatment and management of this condition, and hopefully this as they come up with these conditions, even as they look at the treatment component, the medicine component, can they also include the diagnostic and the monitoring component, which is an essential component of the management of NCDs. What I'd like to urge the government to do is that with the increasing burden of non-communicable diseases in our country, which we are busy trying to tackle, we also need to focus on prevention. By and large, the majority of non-communicable diseases can be prevented. Of course, there are those which have a genetic component, like sickle cell disease or type 1 diabetes, and these may not necessarily be preventable. But a lot of the other NCDs, like type 2 diabetes, the majority of cardiovascular conditions, can actually be prevented. So even as we support the government in terms of creating awareness in the community, screening in the community, we'd also like to urge the government to focus on prevention and to provide opportunities for people to be screened at minimal cost. And also, we'd like to urge the non-health sector to join us in aspects of prevention of NCDs.